Hello, today we're going to review the Women's Reproductive Health Services policy that was recently sent out. Today's objectives are to ensure that Primary Health Network is compliant with laws related to women's health services, to review the Hyde Amendment and what exceptions it includes, and to know what to do with assisting patients with abortions and their women's health needs. The Hyde Amendment was passed in 2013 and doesn't allow for federal funding for abortions. Because Primary Health Network is an SQHC, there are certain requirements when dealing with women's reproductive health. These requirements focus on family planning services, options counseling, contraceptive methods, and abortions. There are a few exceptions where federal funds can be used for abortions if the patient meets any of these requirements. If the pregnancy is a result of an act of rape or incest, or if the woman suffers from a physical disorder, injury, or illness that would place the woman in danger of death unless an abortion is performed. These must be certified by a physician. These can also include life-endangering physical conditions that arise from or created by the pregnancy. Primary health has to be compliant with coercion. So coercion means that the staff can't pressure a patient to undergo an abortion. So an example of this is if we had a pregnant patient in the office and we told them that they could not continue to be a patient with Primary Health Network unless they had an abortion. Voluntary family planning services are part of a requirement for PHN that falls under the Hyde Amendment. Basically, this means that Primary Health Network staff should provide patients with appropriate options for their family planning method. These services could include something like birth control pills prescribed either at our office or by an outside provider, depot injections, things like IUD placements, such as the Mirena. Some sites are required to provide family planning services, and these are our OBGYN sites, pediatrics, and family practice. So options counseling can be offered by a Primary Health Network provider or by a provider outside of Primary Health Network. It should be non-directive counseling, which means providing neutral information that doesn't lead patients in a certain direction. The topics that should be offered are prenatal care and delivery, infant care, foster care or adoption, and pregnancy termination. When it comes to abortion referrals, Primary Health Network, as we discussed, cannot perform abortion procedures. This includes medication abortions because of the federal funding. When we discuss the exceptions that were previously listed, that has to do with the abortions. And basically it states that if the abortion does fall under one of the exceptions, then Primary Health Network staff can provide the patient with a referral to another medical facility that would furnish the abortions. However, if the patient's requesting an abortion and it does not fall under any part of the exceptions listed, Primary Health Network staff cannot provide the patient with an actual referral, but they may provide them with a list of facilities that offer abortions. However, they can't take any further actions like making an appointment or arranging for them to have transportation.